Why can't you remove an infected cyst? Because it is, well, two reasons. First of all, the wound's likely to get infected. So if there's infection in the area, you don't want to kind of make a surgical incision and get the cyst out, because the wound's likely to get infected. So that's number one reason. And number two reason is that you're very welcome, Susie, is that the the cyst will be hard to remove. So having spoken earlier about cysts recurring, it's much more likely to recur when you remove an infected cyst, because it's kind of really soft. The cyst wall is really soft. It's not hard and nice and discreet, so you can't get it out like a marble. It's all like just all breaks apart. So it's really hard to be convinced that you've got all of that cyst wall out. So so those are the situations when you try and remove infected cysts, that they often recur because you're taking out the cyst wall in bits. And so if you kind of take out the cyst and it looks like bits on your trolley, then you think, right, I might not have removed it all. It might have to come back. But if it looks like a ball or has some resemblance to a ball, then you might think that you've got it all out. And so ideally you don't want to be doing the surgery when it's infected. The other thing about removing infected cyst is that the local anesthetic doesn't work very well when there's infection in the area. So it's just never a pleasant thing for anyone. It's not pleasant for the patient. It's not pleasant for the surgeon. As I say, the local doesn't work very well, and the surgery is just not very nice at all, because there's kind of bits and the local hasn't worked, and it's all friable and just really hard to get all of the cyst out. So it's just a no-go. So it's often people contact us and say, look, I've got an infected cyst, it's really bad, it's all inflamed, it's horrible, and we'll say, look, we can't help you. It sounds bad, but it's just not good for anyone. So you're better off getting the infection sorted, leaving it a month or two. Once it's all quiet, that's the time to remove the cyst, not when it's infected. You might need A&E, you might need antibiotics, you might need drainage. We tend not to get involved with any of those things. We get involved once the cyst has kind of settled.
Thank you for watching the video. If you have anything that you would like me to have a look at and give you an opinion on, please send us a message on WhatsApp. The number is 07794 739 606. Be great to hear from you.